Hello, good day to you. It is me, and this episode is going to be put out on YouTube. However, I don't know how long it will last because of the nature of the title. It's a story that's out on the media. You may not have seen it, but it was out yesterday. Francesca Martinez also advertised it as being an article. It is very, very sad. I'm going to let you read it. I'm not going to say it verbally because I don't want it to be picked up, even though it might be. So there we go. That is the heading. That 2/3 are people with disabilities. Shocking. Very, very shocking. Figures were shared on this lady's Instagram, and this is definitely going to pick up and make all the major news outlets, said Nina Tame, a disability rights activist with 17,000 followers on Instagram. The stats, however, didn't make nearly the kind of impact that was expected. It's just a feeling of, oh well, it doesn't really matter, she said. This pandemic has highlighted how disposable we're seen as. On 19th of June, the ONS released stats which showed that 2/3 of people who have died from virus, that's between March and May, had a disability. Out of an overall 38,000, 22,500 of those were disabled people. Tame and her friend Charlie, who were both disabled, analysed these stats and sent a statement to Novara Media detailing the huge number of preventable disabled deaths that had occurred in the UK during the course of this pandemic. And they highlighted the ways that the government views the disabled population as collateral damage in preserving the economy. The failure to protect the disabled community, they wrote, is eugenics in action. Along with other disabled organisations such as DPAC, Disabled People Against Cuts, they are calling for an official inquiry into the deaths. While such an inquiry is needed in order to confirm the relative impact of different factors leading to this disproportionate rate, the disabled community is already well aware of how the government has failed them. It's difficult to know from the information that's available to know exactly why the death rate has been so high, but from the very start there have been legal challenges because everything the government has done has basically been a breach of disabled people's human rights. Many disabled people were missed off the government list of clinically extremely vulnerable people, meaning that they were not provided with food supplies, able to get delivery slots, or to receive help accessing essential medication. Nevertheless, many of these people knew their pre-existing conditions, and health meant they needed a shield. They were having to put themselves in a really vulnerable situations to go out to be able to get food and essentials. Meanwhile, Charlie Martin said that the government food delivery schemes have been extremely chaotic in terms of access, quality and consistency, and the government support with food provisions will be removed from the end of this month, that's July. As a result, they've been getting friends to deliver shopping throughout the crisis, and feeling that with the easing of lockdown, this will become more difficult, as there will be an assumption that it's safe for me to go out to the supermarket. And that's contrary to the doctor's advice. It's unclear how many people have actually died directly due to the government negligence in relation to the disabled community. One disabled person living with mental distress in diabetes in London starved to death during the lockdown as he was unable to get food. And disability activists said this is likely not an isolated case. About 45% of people who should be on the shielding list were left out, meaning they did not get food parcels or priority deliveries. It's been total chaos and incompetence from the start. There's been no provision put in place nationally, and locally it's been very much postcode lottery as what you get from, say, social services. The government's failure to consider disabled people's needs in its response also means that many have been left without the care that makes some independent living possible. A shortage of care staff, PPE and tests have left many people unable to have their basic needs met, such as washing, cooking, cleaning and toileting help. At the beginning of lockdown, social care just wasn't thought about at all. Disabled people had to weigh up the risks of, okay, do I have a carer come in who's got no PPE, or just go without having a carer? The only disabled people in care homes, hospitals or other institutions where the virus has spread quickly were left highly vulnerable. A lot of people, including many with learning difficulties, had DNR, do not resuscitate notices, slapped on them by their GP without any consent from relatives or any discussion with them. It was all this sort of stuff that just sent out this really clear message about how undervalued as a community we are. Now, obviously, the government's failures during the pandemic is hit against 10 years of austerity, which has hit disabled people the hardest. A recent survey by the Greater Manchester Disabled People's Panel concluded that existing structural and societal exclusion, discrimination and equality was the context for the pandemic having a compounded impact on disabled people. This discrimination manifested itself in many ways. Boris Johnson's televised announcements did not have sign language, while offers of support in the forms of leaflets and posters weren't accessible for some blind people. People in the deaf and blind community were felt truly isolated because they weren't able to access the information that was coming through. Throughout the pandemic, we've had to listen to people debating the worthiness of our lives. They've been using the word vulnerable as if we're all about to pop our clogs at any minute. But in actual fact, what makes so many of us vulnerable is the government's failings towards us. So they're calling for an urgent inquiry. It needs to be looked at whether it was just incompetence or whether it was deliberate eugenics policy. Now, as lockdown eases, there's many in the disabled community are feeling scared and gaslit by the government's mixed messages and the absence of support. The non-disabled people can show solidarity by wearing a mask as an act of community and by checking in with local communities to see if anyone who is still shielding needs support. So what's really difficult is that it feels like we're being told our lives are worth less than the economy, and I'm sure there's lots of thinking around this in that a lot of us can't work and we're on benefits. We're not Tory voters, and I've no doubt that a lot of this is politically motivated. So as you see, quite a lot of people are concerned with this, and it has yet to continue. And then we're going to have the finger pointing that you're not wearing a mask, you must be different, you must be not complying. Although my personal experience of it today was fairly positive. They just said, you're exempt, aren't you? And I said yes. So it was the case of they weren't arguing about it, and there was nobody else in the shop pointing their fingers at me. But, I live in a small town. That's it for today. Hopefully this video will be okay. We'll get put up on YouTube and also on brand YouTube. If it's not here on YouTube, it will be found elsewhere. So have a good day and bye for now.